Welcome to your surgery rotation. My name is Paul Del Prado. I am the Chief of General Surgery here in Valleywise Hospital and Medical Center. And so it is very important to prepare you for this rotation. So what are the things you need to know? Number one, in any rotation, it is very important for you to understand how you are being evaluated. And so I do recommend for the people who are from Creighton to bring your passport and ensure that you actually get all the feedback that you can from both attendings and residents. It should be active feedback anytime you perform because this becomes the basis of your rotation director to write your recommendations. The other thing that you have to understand for those who are not from Creighton, there is a paper format which has a picture and your name so I can identify you, and this is also done the same way. You basically have your evaluators put in their recommendations or feedback based on your presentations or performance. This provides an active feedback so that you can change and improve upon yourselves during the rotation, not at the end. The other thing you have to understand if you're aiming to get honors is how am I actually being evaluated? Every school has their own evaluation sheet. How people do their H&Ps, how they ask questions, are they open-ended? So I would just inquire or look at your previous evaluations, what these parameters are so that you can focus on them. But besides that one, the rotation is actually to teach you how to become a doctor, not just a surgeon. It is a surgery rotation, but our goal here is to provide you an exposure and to understand what we do and how to interact with us. We work on patient presentation, taking care of patients, seeing them, and working through an algorithm and thought process by understanding the things that you read and then putting them into action by applying them based on their principles, solving problems that the patient come in with. So I hope you guys understand everything that you need and hope you enjoy the rotation.